My name is Ravi Bhogu, founder of Monitra Healthcare, and I have close to around 20 years of experience in medical devices across multiple countries: United States, India, Australia, New Zealand, and a couple of other APAC countries. Worked in R&D, sales and marketing, clinical, and worked in startups and major conglomerates like Johnson and Johnson as well. At Monitra Healthcare, we are trying to solve two biggest problems in clinical cardiology. One is patients faint, and second is patients have these episodic palpitations. Very difficult to diagnose. The reason it's difficult to diagnose is, number one, you can't predict when symptoms are going to occur. And second is, the only way a clinician knows what's going wrong is if there's data before the episode. To understand, what triggered the symptom. But the way our current healthcare system is structured is all the tests are done, after the symptom occurs. So that's where we have built a complete end-to-end platform. It consists of band-aid like stickers that you peel it off, put it onto your chest. All the data from there goes to the phone to the cloud. And in real time, we come to know what's going wrong with patients. So that's in a nutshell. We have commercially launched the product. We are seeing tremendous traction. Earlier, we were only in Hyderabad. Now we've expanded to western part of the country in India and also in South. We give you a rough idea in terms of what kind of people that we engage. Broadly speaking, we are a product-driven organization. A major portion of our talent pool is on the R&D side. So for us, R&D cuts across physical products, mobile app development, and cloud development as well. So we hire across these three roles on the R&D side. And then coming to commercialization, which is a key aspect of what we're doing out here. Earlier, our approach was, say, feet on the street. We used to hire, say, sales people who would go and do outreach to hospitals as well as individual doctors. But this is where recently we felt that digital has a very strong role to play. And because primarily from a marketing standpoint, digital as a medium through social media, through online, and through other forums, our ability to access and spread the message, is far more easier and compared to the regular feet on the street approach. So in this particular role, one of the biggest challenges that we face as a company is we don't have an internal subject matter expert to drive this particular area. So which is where we look for agencies to help us in terms of, number one, how do you articulate an appropriate message? And that message is something that differentiates our place. And also, find out what could be the stickiness of our message to our relevant stakeholders. So that's an area that it's a work in progress at our end. Recently we have hired a person who will spearhead our marketing, and we're trying to sort of work with agencies to help us in terms of crafting that appropriate messaging and also appropriate creators and what sort of channels that we should go about passing on these messages to. In terms of skills that we look at is prior experience in healthcare industry is a must. Now coming to within healthcare, we look at, say, pharma or medical devices. Either of these two is okay. An MBA is a plus. Prior role in marketing is a must. And in addition to this, anything if they've done on the digital marketing side is a definite plus, is what we look for. So that's on the kind of talent that we are hiring for in this particular role. In terms of specific recruitment challenges that we have faced, it's an evolving field when we talk about digital health, because I think a large portion of it is how do you understand your customers? Because at the end of the day, outreach is a function of your ability to understand your customers and try to reach out to them in through different forums, different places, and craft your appropriate communication messaging. So in this particular case, people who have very strong experience in being successful in terms of doing outreach with through digital marketing or digital health is something that we have not been successful out there. Any advice or any need on this particular front, any guidance on this front would be most welcome. Of course, if there are any specific customized digital health training programs for such professionals, it's a definite plus plus. We would be always welcome, and we would suggest some of our key people to attend such courses and then thereafter, attend them. In terms of R&D, typically we have three roles, like I said, hardware and firmware development. Um, the kind of people who have this specific skill set that understand, both hardware as well as the software that needs to be written for that. These are called firmware engineers. The talent pool who are really, really good is very, very small in the industry. So which is why, for us, that's a core of our business. So we don't typically hire freshers out here because the skill set with which freshers come, and in terms of our implementation of what is required, right? It would involve significant amount of training, and that's time, money, and cost as well. So it's something that at this moment in time, the call that we've taken is we do not hire freshers for this particular role. Now coming to the second part, which is mobile app development. So you have, say, Android developers, you have iOS developers, which are two different skill sets. Rather than hiring someone in-house, our approach has been that, let's hire agencies who can help us out, because it comes in waves of requirements. And then, one agency that can do both is always, helpful. So we went through this entire cycle to identify an appropriate agency who can help us out. So we've been working with them, for a period of time, and we've been fairly, again, we don't, it's not a full-time requirement. That's the reason that we've hired the agency for it. Now coming to a cloud is a very critical enabler for us. Now that's where we have hired a lot of freshers. And then the person who spearheads this for us is Sashank. Sashank is a ex-Oracle alum, very strong in terms of how do you structure your backend, how do you store data, how do you, okay, there are three things that he looks at. One is, how do you ensure availability all the time? Second thing that he looks at is how do you have appropriate security protocols in place so that there is encryption at rest and encryption at transit. Third aspect that he looks at is, how do you keep your cost footprint on the cloud very, very low? And since he comes with a very, very strong subject matter expertise, we've been, hiring freshers for this particular role. These are computer science graduates. These are, ECE graduates. We take them on board. It's an intern to hire sort of a process that we have followed. So as of now, we have a team of roughly around 5 people reporting into Sashank. All of these have come from the intern to hire sort of a process that we have followed. So that's on the, our core product side. Now, in terms of, say, the other aspect of our product also involves reporting. So we have tons of data that comes in, and the algorithms, machine learning, artificial intelligence, all these do a heavy lifting for us to be able to identify where the heartbeat is located and what type of heartbeat it is. Is it normal? Is it abnormal? If it is abnormal, what kind of abnormality? Are there false positives or false negatives? So out here, do their job, we need a team of people who go and are a layer between the doctor and the algorithm. Because the reality is that, doctors don't want to be bothered by false positives that come through, and they won't be in a position to respond. So which is why we have a layer of, which consists of a team of people whose job is to look at the output of the algorithm and confirm whether it is correct or not correct. If it's not correct, they'll go and correct it using our tools that we have developed. So this is where we again hire for freshers, and we have a training curriculum where we run them through, what are the things to look out for, what's our, internal processes, what are our internal workflow mechanisms, and what is the quality, checks, QC checks that we do. We have subject matter experts out here, and then we train people. And this is where we would need a significant number of people in the next 12 months to hire in this particular role. While we have hired at people for this particular role, reputed institutes, but I think as we scale, identifying good talent in this particular role is where we anticipate some challenge to come through, and we are constantly looking out for institutes and also people to help us out in terms of identifying the right talent pool for this particular role. Now, coming to our commercial sales. Commercial sales is something that where we look for people with 2 to 3 years of experience, bring them on board. We have our internal Salesforce effectiveness program, run it through that. We also are trying to spruce up our marketing team on the digital health front. It's an area of learning. We're not strong at that, but it's work in progress for us. So if there is any guidance, that would be very, very helpful. Short answer is we would love it. Okay. It's a significant gap. Identifying the right talent pool and bringing them on board is a process and it takes time. And it's the cost of an incorrect hire is quite long for us. So if there is, something available to this effect, we would welcome it and we would be happy to jump on board. So I think number one thing that we look for in terms of our people is, communication skills. Strong communication skills is very, very important. The languages that we typically look for are English and Hindi, and vernacular languages depending on the region that they come through. But these two are critical for us in terms of communication skills. When we talk about communication skills, is the empathy with which they communicate to the end consumers who are patients in this particular case. So the tone, the language, the warmth, they should bring about in their conversation is very, very important. So that's something that we look for. If they have prior sort of training that they have undergone, it becomes much easier for us. So that's because it's a soft skill, but it's a very important skill. Then in addition to it, we also look for in terms of hard skills, specifically for our role, we typically have been hiring from, say, diploma in, say, cath lab technology, diploma in cardiology, is something that we have been hiring for. Basic understanding in terms of EKG, basic understanding is good enough for us. As long as they understand, say, normal sinus rhythm, they understand the different waveforms, any changes around that, is something that would, be very, very welcome, because that's, it takes some time for us to sort of train our people on this front. Then in addition to this, another area that we have found, which is very, very important, is the attitude of, say, young people coming into specific roles. Now, the expectation versus reality is something that we try to manage. So we want people who are flexible in terms of their needs, because ideally we want people to grow in our organization in various roles. So if when during their education or during training programs, if there is an understanding in terms of their ability to understand what does the industry require, could possibly change over a period of time. And if they could sort of adapt out there, because we find that people typically come with certain role in their mind, but if there's a change in that, it becomes very difficult for us to adjust. So that's, I know that's something that we look out for in our personnel. So I think biostatistics is very, very important. Because at the end of the day, you'll be doing a lot of studies, and then how do you interpret the data and showcase the data becomes very important. In addition to it, if someone is looking to pursue a role in, say, biomedical, right, being able to understand a combination of mechanical, electrical, electronics, and data science is very, very important. Someone who has a broad understanding of all these 4 aspects, and with a specific focus in any one of them, is very, very welcome. In addition to this, that's on the technical side. And on top of this, if someone has, say, understanding of, say, commercial aspects also, and I'm pushing the envelope, someone who has, say, understanding on marketing, sales, outreach in terms of doctors, is something that is even. So, because what happens is this sort of a bent of mind helps us in terms of crafting better products and, also communicating the value of our products to our customers. Vishy, it sounds very good. As a curriculum that you had mentioned in this thing, I have sent it to a marketing person as well. I think it's very well structured. If there's a, curriculum around this, I think it'd be worthwhile for someone of our team to attend. The learning objectives that you have articulated are very, very well, good.